Thank you, Mr. Williams, and a pleasant good afternoon to everyone who is joining us this afternoon. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for Wednesday, December 9th. Last weekend, more specifically last Saturday, December the 5th, the Ministry of Health would have issued a media release announcing 3 additional cases of coronavirus disease within the Federation. One of the individuals landed in St. Kitts on November 20 from India. The other individual would have landed on November 28 from the United States of America, and one individual landed in the Federation on November 29th from the United States of America. Ladies and gentlemen, this afternoon, Wednesday, December 9th, I want to use this platform to announce yet another case of coronavirus disease. And so, yes, we do have an additional case. This is hot off the press. We just received that call at 5:01 p.m. this afternoon. So we have a total of 26 confirmed cases of COVID-19 from or within the Federation of St. Kitts and Nevis. This individual, or this last case, landed in the Federation on November 25 from the United States of America. I want to assure the general public that these 4 additional imported cases have been in quarantine since they arrived on the Federation. And so, given our 26 cases, the rate of infection of COVID-19 in the Federation per 100,000 stands at 48.9. And so in terms of total number of confirmed cases of COVID-19, St. Kitts 18, Nevis 7 plus 1, or a total of 8, and the Federation has a total number of confirmed cases of 26. 26 confirmed cases of COVID-19. Globally, based on the World Health Organization's COVID-19 dashboard, the count in terms of the total confirmed cases internationally, it stands at 67.5 million. The total number of deaths stands at 1.54 million. In the United States of America, there are 15.1 million confirmed cases and 338 deaths in the United States of America. What's happening in the Caribbean region? Based on the Caribbean Public Health Agency's situation report dated December 7th, there are 307,232 confirmed cases within the Caribbean region and a total of 5,306 deaths from COVID-19. In St. Kitts and Nevis, we continue testing all the returning nationals and incoming travelers. And to date, we would have tested 4,335 persons, and we have had 26 positive cases so far. And so in terms of numbers of persons in isolation, we now have 3 persons in isolation. Total number of persons recovered, 23. Total number of cases, 26. Pre-approved quarantine at home, we have 20 such individuals. Number of persons in other quarantine facilities, meaning government assigned or designated sites and COVID-19 approved hotels, 313. And so by way of information, we have quite a bit to share this afternoon. Okay, so we continue to provide the website www.knatravelform.kn. And so this is the website you log on to if you want to complete the entry form ahead of coming into St. Kitts and Nevis. Okay, so we want to just highlight the fact that the Ministry of Health accepts the gold standard, the reverse transcription polymerase chain reaction, which is the RT-PCR laboratory-based molecular test. And so we require a negative RT-PCR test result. We want you to do that test within 72 hours of traveling to the Federation. And so this is the reverse transcription polymerase chain reaction test, not the real time. It's the reverse transcription polymerase chain reaction laboratory-based molecular test. That's the gold standard, and that's the test we accept. We are not accepting the rapid antibody. We are not accepting the rapid antigen tests. We continue to get a lot of questions regarding children. And so, yes, parents who are coming back with children or international travelers coming with children, we do require them to also have a negative RT-PCR test done within 72 hours of travel. And we want children to be accompanied by at least one adult. Children are also, we want to assure you that it's safe and that children are tested here in the Federation upon completion of their quarantine period. Okay, we want to also highlight the fact that there are travelers who may have special needs. For example, persons with chronic medical conditions, individuals who have to travel via wheelchair, who may have challenges with activities of daily living. These individuals, we recommend that you provide us a medical report. This medical report can be sent to Office of the CMO at gov.kn, because in fact, such individuals should be accompanied by an adult to ensure their safety and comfort during the 14 days quarantine period. Because as I said before, there are individuals who may have traveled in a wheelchair, who may have challenges with activities of daily living, and they may need assistance in terms of self-care during the 14-day quarantine period. And so they would benefit if an adult is in quarantine with them. Okay, so let's talk about the vaccine. So last week, Wednesday, the BBC announced that the Medicines and Healthcare Products Regulatory Agency in the United Kingdom granted approval to the Pfizer-BioNTech vaccine. And so the MHRA granted temporary authorization for emergency use of this vaccine in the United Kingdom. The rollout of this vaccine actually started yesterday. So those of us who would have watched BBC, we would have seen Martin Kenyon, I think his name was, and William Shakespeare, two of quite a bit of older adults who would have received this vaccine. So the first vaccine was administered yesterday, Tuesday, December 8th. So it was rolled out in a number of hospitals in the United Kingdom. We understand that the UK would have purchased over 800,000 doses to be administered in the first instance, and the UK has ordered over 40 million doses. So they intend to vaccinate about 20 million of their nationals and citizens. Fresh off the press, today, Canada announced that they are joining the United Kingdom. Canada's health regulator approved the Pfizer-BioNTech vaccine. Health Canada called the authorization a critical milestone in Canada's fight against the coronavirus. Canada is set to receive as many as 249,000 doses of this vaccine. And we note that the United States of America's Food and Drug Administration, the FDA, is set to meet tomorrow to make a critical landmark decision with respect to the authorization of this vaccine in the United States of America. Pfizer-BioNTech's vaccine requires ultra-cold storage at -70 degrees Celsius. However, once it reaches the center where the actual vaccine will be administered, it can be stored in a regular refrigerator for and it must be utilized within a window of 5 days. The vaccine requires 2 doses to be taken 21 days apart. So the data from the trial tells us that immunity starts about day 12 after the individual would have received the first injection. And full immunity is achieved 28 days after the first injection. All right, so let me just explain. All right, so let's say yesterday, William Shakespeare received his vaccine, day 1. On day 12, his immunity against the virus will be mounted. In 21 days, in 20 days, he would receive his second dose. So that's 21 days after the first day. And then 28 days after yesterday, the first day, he would have mounted full immunity against the virus. Now, the vaccine uses COVID-19 virus genetic code or messenger RNA to prime immunity. In the United Kingdom, the vaccine is being offered to healthcare workers in the National Health Service, residents in long-term care facilities and their care providers, and older adults over age 80 with comorbidities and hospital appointments. Just today, the BBC announced an allergy warning over this new vaccine. So apparently yesterday, amongst the thousands of persons who would have received their first dose, 2 NHS workers experienced allergic reactions shortly after receiving the vaccine. The data or the information on BBC tells us that both NHS workers, they have had a history of serious allergies prior to this, to the point where they both carried an adrenaline auto-injector or adrenaline or EpiPen, as we would call it. And so this is a strong warning. So individuals who suffer food allergies, allergies to previous vaccines, or allergies to previously taken medication, you really should avoid taking this vaccine. The trial reports 1 possible allergic reaction per 1,000 people or person immunized. And this is from BBC Today. Some additional data regarding this vaccine. As I said before, protective immunity builds up within 28 days or 4 weeks following the first dose. And so there's a question that most persons are asking: how long does immunity last after receiving this vaccination? The answer, we are not sure. Second question, does this vaccine protect everyone? The answer, no. In the trial that was conducted prior to the authorization of this vaccine, the vaccine did not prevent everyone vaccinated from contracting the virus. Does the vaccine stop persons from catching the virus? Does the vaccine stop persons from transmitting the virus? The answer to those 2 questions, we still do not know. Question, has the full data from the trial been published? No, it hasn't. So ladies and gentlemen, there are still many unknowns regarding this vaccine, and scientists and health practitioners like ourselves, we are hopeful that this data gap will be filled within the next few months. So in other words, if, you can receive this vaccine, but we still do not know if receiving the vaccine will prevent you catching the virus. We do not know if when you receive the vaccine, it will prevent you transmitting the virus to someone else. So these are still unknowns. Pfizer-BioNTech vaccine, the trial participants were 85 years and under. So it's important to note that the trial that preceded the authorization of this vaccine only included participants who were 85 years and under. The vaccine was generally well tolerated by the participants in the trial, and we were told, or we are being told, that they only experienced mild effects. And some of these mild effects that I've seen in the literature include pain at the injection site, muscle pain, fatigue, headaches, and of course allergic reaction, because we've had 2 persons yesterday, 2 NHS workers who experienced significant allergic reaction post receiving the vaccine. And so, ladies and gentlemen, based on the information I just shared, and the data gap that still exists regarding this vaccine, we will continue utilizing our health and travel protocols, which requires you to provide us your pre-arrival RT-PCR test, negative of course, and when you come into St. Kitts and Nevis, we will maintain our quarantine period and our vacation in place period of 14 days. So the rollout of the vaccine at this time will not change our health and travel protocols. We are being told that the COVID-19 vaccines will be made available to Caribbean member states by as early as March, or let's say the second quarter of 2021. But please note, we are not sure which of the vaccine candidates will be available to us. So I did mention that we will continue, we will maintain the 14 days quarantine or vacation in place that we have at present. Okay, so last week, Thursday, we received information, another news clip saying, and I quote, CDC will decrease coronavirus quarantine from 14 to 7 to 10 days in the United States of America. So basically, that article said that if you're in the US and you were exposed to an individual who was COVID-19 positive, you would quarantine for 7 days, test, and if you got a negative test, you can cease quarantine. And if you did not get a test, you can remain in quarantine for 10 days and then be released from quarantine. Now, there has been some misunderstanding regarding this CDC statement, because this really, this statement is providing guidance within the United States of America. Please note that in the United States of America, the COVID-19 disease is rampant. Contact tracing has virtually been abandoned, and there is a recommendation to reduce the quarantine period, especially in areas where the cases are rapidly rising and health authorities are inundated. So this is not the case in our Federation of St. Kitts and Nevis. So it's important to note that this statement or this recommendation is not made by the World Health Organization, it's not made by the Pan American Health Organization, but by the Centers for Disease Control for guidance in the United States of America. One of the directors of CDC provided the rationale. He said the goal for this new guidance is to increase compliance with quarantine protocols and potentially alleviate the economic burden on those in the United States of America who cannot meet the 14-day quarantine period. The Centers for Disease Control continues to endorse quarantine for 14 days, and recognizes that any quarantine shorter than 14 days balances reduced burden against a small possibility of spreading the virus. Based on the foregoing, ladies and gentlemen, St. Kitts and Nevis continues to maintain the required gold standard 14 days quarantine period for all inbound travelers, along with the present health and travel protocols. Based on all that we would have shared and the data gap regarding the vaccine, it's important for us to continue to boost our own immune systems. So I want to recommend that we continue doing same through exercise, eating healthily, ensuring that we get adequate rest, ensuring that we are properly hydrated, and ensuring that we manage our stress levels and cope therewith. We must continue the COVID-19 prevention and control measures. These have proven to work. I don't think there's any data gap with respect to these prevention and control measures. Actually, we are receiving more and more scientific evidence to back these prevention and control measures. The need for us to continue wearing our face mask when in public places. The data is now showing the thousands and millions of cases of COVID-19 that has been prevented by just wearing the face mask, maintaining appropriate and adequate hand hygiene, maintaining 6 feet distance away from others when in crowded spaces, and avoiding crowds and events with significant numbers of persons. Thank you.